Hi, everyone. So, in this session I'll be talking about today, we meet 15-year-old Sarah, accompanied by her mother and father. The primary concern brought into the session is Sarah's increasing conflict with her parents, specifically around curfew, school attendance, and her relationship with a boy named Jason. The mother describes Jason as a bad influence, someone who drives recklessly, has no goals, and encourages Sarah to stay out late and skip school, in her opinion. She expresses significant worry about Sarah's safety, especially late at night. Sarah speaks very little in this segment outside of refuting some of her mother's assertions, um, until she actively seeks out her father's input in the session. The father is quiet through most of the session until prompted by his daughter, at which time he expresses slightly different concerns. And while he agrees that the late nights are a problem, he frames the issue more around reliability and consistency, believing if Sarah had demonstrated more dependability, especially during the week, the parents could, quote unquote, cut her some slack on the weekend. Overall, the family presents with a communication breakdown, parental worry and frustration regarding educational issues, and Sarah's relationship, which they with Jason, which they perceive as risky. There's lack of trust and reliability within the family system, and relational stress in the setting of adolescent developmental transitions. A significant dynamic presenting in the session is triangulation. The mother and father are not fully aligned on expectations. Mom escalates her worry and anger, and dad tries to mediate and soften expectations. This creates a dynamic of mom versus Sarah, dad in the middle, which increases conflict. Instead of resolving it, the therapist works gently to detriangulate by clarifying each parent's perspective, validating both, and shifting the focus back to shared goals. Dr. Berg uses solution-focused techniques, including reframing, shifting mom's anger into concern for safety, complementing and validation, highlighting the father's reasonable point about reliability and clarification of goals, specifically around whether the curfew time or more consistent reliability and accountability are most important to the family system. She also brings out multiple viewpoints and begins to redirect the conversation toward solution instead of blaming. If I were to continue solution-focused brief therapy with the family, I'd probably begin with helping the family to describe their best hopes for therapy, using the miracle question to help them imagine what life would look like without family conflict, exploring expectations, such as nights when Sarah did come home on time or when their communications went better. I'd also use scaling to help them measure trust and safety. Things like on a scale from 0 to 10, where are they feeling in terms of trust today, and what can we do to improve that by one scale point this week? Finally, I'd help them develop one or two small concrete steps, such as maybe Sarah checking in by text message, or all three members of the family agreeing on a curfew time, or adjusting curfew time on the weekends as consistency improves. Overall, focusing on small successes and strengths identified within the family system, and helping the family to develop a shared vision about how they would like things to look, reducing triangulation and strengthening the parental alliance, and empowering Sarah to participate in the solution. Thank you.